Hello, folks. What's the topic this week? Well, it's perimenopause and menopause. So, what is perimenopause? It's literally the beginning of menopause, the things that happen before full-blown menopause. And it's things that you might miss. Now, they say 40 years old or as young as 35 can be the start of a menopause. But there's been reports of women much younger. So we can't really say what age that's going to be. But on average, it's when you head into your 40s, things will start to change. You might miss a period. They might be lighter. They might be heavier. You might start getting hot flashes. Night sweats. Brain fog. Sleepless nights. So approximately 80% of women suffer with the symptoms. They'll experience menopausal symptoms as the hormone levels, the estrogen and progesterone, and testosterone, start to decrease. The classic symptoms that most people associate with menopause are night sweats and hot flashes. That's what we all think of, isn't it? But not everyone gets these. And symptoms of menopause are much more varied than we hear about. There's over 34 recognised symptoms of menopause. Recognised. Identifying the symptoms can be difficult for a woman. It can be confusing. We're going to be putting it down to many other things. Sometimes if women's period, oh my God, am I pregnant even? Many women delay getting help for the symptoms because they didn't realise, it was their time to go through the menopause, or it wasn't even on their thought pattern. But, if these things are starting to happen, it happens once, you've missed a period, or it's heavier than normal. It happened once, but if it happens again, go and seek medical advice. There is a blood test they can do to see if you're perimenopausal. It's not like a blood test, yes, you're menopause. It's something to do with the levels. So go and have a chat with your doctor and see what he has to say or she has to say. Some of the symptoms, my gosh, and this is only some of them. Your irregular periods, your hot flashes and flushes, your night sweats, brain fog, difficulty concentrating and keeping your focus on something, memory problems, anxiety, depression, mood swings, angry, irritability, emotional crying, changes in your body odour, insomnia, fatigue, headaches, more frequent urination, going to the toilet more often, vaginal dryness can occur, or soreness, or vaginal itching. You may lose your libido. You might have dry skin, itchy skin, feel like something's crawling under your skin, brittle nails, hair loss, not just on your head. I lost my eyebrows. Body hair, legs, underarms, other places. Digestive problems, heartburn, dyspepsia, constipation, bloating. Burning mouth syndrome, that's one I had. And the doctors couldn't tell me what it was. It's one of the symptoms of menopause. And I think that's got something to do with acidity or something. Palpitations, dizziness, feeling like an absolute emotional and physical wreck. Joint pains, everything, aches and pains. This happens to us women. Some people will sail through perimenopause and menopause. Others will experience it at different levels, and some very severe where it is very impactful on their life in a negative way, not in a positive way. So why does menopause have so many symptoms? Why do all them things happen? Well, if you think, our hormones circulate around our body, and they exert an effect on any cell that they come in contact with that has the right receptor to recognise it. We know that estrogen Estrogen receptors are present in the majority of tissues around the body. So it stands to reason that a decline in estrogen can affect almost any part of your body, including those you might not automatically think of, like your immune system, your fat cells. Maybe that's why you get they say you gain weight around the middle, your skin, your gut, and your central nervous system. So in the lead up, the perimenopause, that's when your periods, your cycles and your period may change. They might get lighter also, or heavier. The sweats might start. The hot flushes in the night time. Even during the day. Hot flashes during the day, night sweats on the night time. Some people experience that just on the chest and up the neck. Some can experience it in the full body. And some actually sweat so much they have to get up and change the bedding during the night. Brain fog and difficulty concentrating, all these things that happen to women. So many symptoms. How do women keep going? How do you stay present? How do you manage all that? It is hard, I'm telling you, because I've gone through it. It's hard, and it's a very I think there should be more out there so everybody knows just how impactful it is, because everybody treats you the same. You're still meant to show up. You're still meant to be present at work, at home, with your children, with your housework, with your friends, with your family, or you're still meant to be present with everything. Nobody's known what's going on with all of these symptoms in your body, other than the older woman who's already been there. The men don't know. The younger ones don't know. Work don't care, really. They just want you in your workplace because that's what you're getting paid for. It's hard. It's really hard. Women have still got to manage the home, relationships, children possibly, work. They've still got to manage all that, going through all of these horrendous symptoms. And it's not like you're going through it for a year. You're going through it for years, sometimes well over 10 years even. It's a long haul. How do we prepare ourselves for it? Or how can we, look after our health for optimum health during that time? What can we do to help us, with sleep, with the symptoms? Let's have a look. So treatment options. The treatment options are to relieve the symptoms like hot flashes, vaginal dryness, mood swings, and primarily what's on offer is HRT, hormone replacement therapy. There are also non-hormonal alternatives. Common treatments include estrogen-based therapies, low-dose birth control pill, antidepressants, and lifestyle adjustments. But obviously, you've got to tailor things to individual needs and health risks. So a little bit about the hormone replacement, HRT and HT. Systemic HRT pills, patches, gels or sprays that deliver estrogen to the whole body, often combined with progesterone for women with a uterus to protect against endometrial cancer. Right. Low-dose vaginal estrogen, creams, tablets or rings that treat localized symptoms like vaginal dryness and urinary issues with minimal whole body absorption. Now I am reading this from the Women's Health. Testosterone, sometimes prescribed for low libido. There you go. So your sex drive's gone. Testosterone. Non-hormonal medications. Fezolinetant, Fezolinetant, a newer drug specifically for hot flashes that regulates temperature control in the brain. Antidepressants like paroxetine that can reduce hot flashes and improve mood. Ospemifene, a pill that acts like estrogen in the body to treat vaginal dryness and painful sex. Gabapentin, well, I hate that word. Clonidine, often used to manage hot flashes and insomnia. Lifestyle and other options. Vaginal moisturizers, lubricants, non-hormonal products. Cognitive behavioral therapy, and I think there's new NICE guidelines on this. It's a type of talking therapy, but this is effective only for like low mood, anxiety, stress that's been caused by your symptoms. It's not going to treat the symptoms themselves. Lifestyle changes like regular exercise, looking at your diet, maintaining a healthy weight, they can all help improve that and reduce cardiovascular risks. But it's always important to discuss your options with your GP or with your professional service provider. What is the right option for you? Let's get to some of the viewers that have sent in. Let's get some of what they've said. So a few of our responses that viewers have sent in, thank you so much for taking the time to do that and let us know about your experience. So this topic was sparked by one of our viewers and community members, Katie, and this is her experience, the first one we're going to look at today. Well, where do we start? I feel that people just associate hot flushes and mood swings with the peri and the menopause. We are not really geared up for the amount of symptoms that come with it. We're not, are we? I can list all changes to me since it started, but who knows if it's hormonal or something else. So here is Katie's symptoms in order of them starting, she said. Night sweats and flushes, skin issues, rosacea, flare and acne, itchiness, mood swings, joint and nerve pain, acid reflux, and in brackets she's got GERD, anxiety, fatigue, heart palpitations, sensitivity to sounds, electric shock feelings. I know that feeling, it's awful. Non-existent sex drive, loss of libido, weight gain, a short fuse, snaps easy, frequent urination, feeling that I have lost the person I was. That's a common one, I think, amongst us as well, because we don't know who we are anymore. Nausea. And my latest symptom, brain fog. Hopefully the last one. It started slowly for Katie from her age 35 with just the sweats, but 2 years ago, since age 41, it's gotten so bad with all the other symptoms. I am taking health and perimenopause vitamin tablets, which help slightly. I feel that we ladies should have some form of care pack in our 30s. I think that's an excellent idea. To let us know what we could be in store for and where to get help, etc. Also, products we could try. I feel that we are just thrown in at the deep end and hope we can get out the other side of it without drowning, so to speak. So at the moment, Katie feels she's approaching the middle of said pool and can tiptoe to the bottom. I hope the shallow end comes soon. I want to get out now. So thank you so much, Katie, for that. I'm laughing. I'm not laughing at the situation. It is, I'm recognising all your symptoms, Katie. And, do you know, sometimes I wonder, was I suffering from chronic fatigue and fibromyalgia? Or were they all the severity of all of the symptoms of menopause? Who knows? Alison commented on our TikTok post at Cafe Soul Pod. Her mum lost her eyebrows through menopause. She lost body hair. I did too. All my eyebrows gone. Took a while to get used to it, but now I look weird with eyebrows on, I think. So I can really take that, and I don't know how Alison's mum felt, but it can be you don't want to go out. It's all right in the summer, you can put a pair of sunglasses on. Thank goodness for the new eyebrow pencils you can get that you can do them in yourself. But even that's difficult if you wear glasses, because you've got to take your glasses off to do it. So I found it very difficult. I'm getting the hang of it now. I've bought one. don't use it all the time. But that was my solution for losing mine. I don't know what Alison's mum did. I think she had little tufts growing back. I haven't. I've got more like white phallus hairs that are more like spikes now coming around the eyebrows where the eyebrows should be. So I do have to pluck those out because they interfere with my glasses. But I do draw them in with the Hello Kiss eyebrow pencil, which is fabulous. Thank you, Alison. So the next one was Caroline from Bristol, a viewer on TikTok. She feels she's going through it now. Very emotional she's feeling. She's irritable, tearful, fatigued. She just feels tired all the time. She feels like she's lost interest in her life. She's got no motivation. On my journey, some of the times I couldn't tell the difference between what was the chronic fatigue, what was the fibromyalgia, and what was the menopause. It was a very hard journey. So what I'd say to Caroline is, I don't know what is better for you, because that was like, would this be better than, I don't know what would be better for you. Your GP is the best person to speak to. They'll know you. They'll know your records. They can take your bloods. They can do all these things. So Caroline Bristol, very emotional. I hear you. I feel you. Try and, like, well, what I want to say is try and pick up something like a hobby, something that'll take your focus. You know, when you're feeling emotional, I don't know whether you like crafting or painting or, you know, something like that. Take something up, or just go for a walk and get some fresh air, walk it out. But getting out and about is a good thing. Getting that fresh air, walking. Too often we curl up in a ball and succumb to pain and the, oh my God, like a woe is me type of thing. No disrespect, ladies. But it doesn't help us. I had horrendous, when I first started having periods in my youth, it was horrendous. The pain was horrendous. Every month without fail, I was having to get picked up from school and taken home, or Karen would have to take me home, because it was cramps, backache, pain, not ache, pain, headaches, dizziness, and almost like migraine. It was absolutely horrendous. Many times they found us on the toilet floors in school, and they've had to call my parents to come pick me up. So I don't know whether how you start your periods has got anything to do with how you end your periods, or what. But you need to go and see your GP for that one. Jen is dreading it. I had painful periods as a teen. My periods were all over the place. I'm 42 now, and I know it's coming. What would you recommend to use when it happens? HRT, natural products, medication? Again, just as I've said before, Jen, don't dread it. It's too easy to dread something, and that just already sets your bodily vibration in that energy. It's literally preparing yourself, and the best way to prepare yourself is look up the symptoms. I mean, Google's wonderful these days. The NHS is on there, Women's Health, the Mayo Clinic. There's lots of places on Google. Always look at somewhere you can think, right, yeah, that's the NHS. Like what I've just read you there before about the gabapentin and the SNR. That's all from the nhs.uk website. So look up. Do you think you're experiencing, you have all of a sudden you start to become ratty, lack of patience, periods gone funny, over emotional? Look up your symptoms, put them together, go and see your GP. So with over 34 distinct symptoms, it's hard to pick them out. Some of them are common to things that could be happening to us in life, like the insomnia, stress related, water infection. Do you know, we wouldn't normally put that down. A part of that could possibly be I'm going to the toilet too much and I keep getting water infections. It's got something to do with the menopause. Bloating, bowel issues. We don't think. Quite a lot of them, I think all I knew was the hot flashes and moods. That's all we ever really come across. Oh, they get hot flashes and moodiness. What does moodiness mean? It means a lot. Angry, irritable, impatient, emotional, tearful. It encompasses it all. And we still have to carry on. We still have to carry on. So thank you again, Katie, for wanting to address this topic. Many of us women haven't got a clue what we're going through when we're going through it. It's usually like when we're right near the end. So it's good to get other people and other women's, I should say, views on the matter and their experience. The conversation doesn't end with the end of this pod. Join in the conversation. What's your experience? Leave a comment and let us know. I think Katie's idea of a care pack is an excellent idea because it's not talked about. It's just not talked about. Hot flashes and moodiness. That's all we get told. It's not good enough. We need more information, don't we? So my own journey, I can't explain. So that's because I was put down to chronic fatigue, fibromyalgia, and we didn't know what symptoms were what as I'm going through the menopause. But was it menopause all along? Who knows? I don't think we'll ever find out. But what I'd also like to know is, how do your people, have you noticed any difference? Do family have patience with you? Are you showing compassion? Are you showing empathy during your menopausal journey? From my point of view, I can say no, not from any direction. Was I showing compassion, empathy, understanding? None of it. None of it. So if you're someone who's, mother or whoever is going through it, what's your experience of it? What have you noticed about the changes in your person, the mood, the behaviour, all that kind of stuff? Write in and let us know. cafesoulsisters@gmail.com. See you next time.